Hi, this is Stephanie with a short presentation on Medicare Part D prescription drug coverage. We'll talk about enrollment, the different stages of the Part D prescription plan. We'll talk about the penalty associated if you do not enroll right away into a Part D prescription coverage. Medicare Part D prescription drug is an optional benefit offered to everyone who has Medicare. There are two ways to enroll in a prescription drug plan, also known as a PDP. You may enroll via a private insurance carrier that offers a Medicare prescription drug plan that's also known as a standalone prescription plan. You must have Part A or Part B to join a Medicare prescription drug plan. Another way to enroll is through a Medicare Advantage Part C plan. These plans cover everything under one umbrella. They are also offered by a private insurance carrier. You must be enrolled in Part A and Part B with Medicare. Medicare Advantage plans that include drug coverage are called MAPDs. Not all your Medicare Advantage plans include drug coverage. There are 4 stages to a Part D prescription drug plan. The first stage is the annual deductible. The deductible for 2020 is $435. This amount may change every year. Depending on the plan that you're looking at with the private insurance carrier, they may charge the full deductible, a partial deductible, or they may waive the deductible entirely. You will pay the network discounted price for all your medications until the private insurance plan of your choice tallies that you've satisfied the deductible. Once you've met the deductible, you move into the next stage. The next stage is the initial coverage. During this stage, you will pay a copayment for your medication based on the drug formulary of your health insurance plan of your choice. Each drug will separate its medication into tiers based on if the medication is a generic, brand, specialty, and so forth. This particular stage has an out-of-pocket amount in 2020 of $4,020. This is also tallied by your plan so that you can keep track where you're at with that out-of-pocket amount. The next stage, the third stage, is the donut hole, also known as the coverage gap, but I think everybody knows it more as the donut hole. Not everyone will enter this stage. In the coverage gap, or the donut hole, the plan is temporarily limited in how much it can pay for your drugs. If you do enter the donut hole, you'll pay 25% of the cost until it reaches a total out-of-pocket amount of $6,350. Your out-of-pocket cost is calculated by adding the deductible, the coinsurance and copayment from the entire plan year, and what you've paid into the donut hole. The last stage is the catastrophic stage. After your out-of-pocket cost totals the $6,350, you move into the catastrophic stage. You will pay a low coinsurance or copayment amount, which is set forth by Medicare for all your prescription drugs. You will remain in this phase until the end of the year. This slide is a different way to illustrate the 4 stages under the Part D prescription plan. So again, the first stage is the deductible. Not all Part D plans have a deductible. You pay for your drugs until you reach the deductible as it is set forth in your contract by the health plan of your choice. If your plan does not have a deductible, your coverage starts with the first prescription you fill. The second stage is the initial coverage. You stay in this stage until your total drug cost reach $4,020. The third stage is the donut hole. In the donut hole, you pay 25% of the cost up until your out-of-pocket reaches $6,350. The last stage is the catastrophic stage, in which you pay a small copay or co-insurance amount for the remainder of the plan year. I'm going to take a moment to review the Medicare Modernization Act. As a result of this act, each of the insurance carriers offering a Medicare Part D plan must give a standard level of coverage that is set place by Medicare. Plans can change their formulary list, and they can also vary the tiers in which they cover the medications on that formulary list. Every year during open enrollment from October 15th to December 7th, you have the option to review other plans to change coverage based on formulary changes and the tier changes that your carrier may make. So it is important to understand your specific needs and goals, review multiple plan options, and get your questions answered so that you're comfortable with your Medicare choice. This slide reviews if you are currently covered in an employer health plan and determining if that plan is credible coverage. So if you're over the age of 65, you're still actively working, each year by October 15th, your employer should send out a notice to let you know if your prescription drug plan is credible. If you don't recall receiving that letter, you'll need to check with your benefit manager. If your prescription drug plan is not credible with that employer and you do not enroll in a Medicare prescription drug plan, there could be a 1% penalty each month that you're not enrolled. So 1% of the average monthly prescription drug premium times the number of months that you delayed enrollment is the cost of your penalty that will be added to your Part D premium for as long as you're covered under the Medicare prescription drug plan. So we're going to review the Part D penalty in a little bit more detail. If you skip the enrollment into a Part D plan, it could be pretty costly to you during the long term. For each month without coverage, you will pay an additional premium of 1% of the national base beneficiary premium. That amount in 2020 is $32.74, and in 2021 it goes up to $33.06. This is not a one-time penalty. You'll pay it every month for as long as you have Medicare prescription coverage. So in an example, we have the 2021 national base premium amount of $33.06 by 3 years without coverage, or 36 months, for a penalty amount of $11.90 that would be paid each month in addition to the premium of the prescription drug plan. I hope you found this presentation to be informative and learned something from it. If you have additional questions, please don't hesitate to reach out to me by phone, email, or check out my website where there's tools to price compare plans. You can also reference your Medicare and You handbook for more details. Thanks for taking the time, and I look forward to working with you.